Hello, everyone. Welcome to the Treble Health podcast. Today's guest is one of the Treble Health audiologists, Dr. Neidleman Kennedy. Dr. Michelle, welcome. We're excited to share a bit about your career journey, why you specialize in tinnitus and hearing conditions, and some personal things about you that may allow you to connect with some of our YouTube community. And we'll answer some questions that a lot of people have about tinnitus and who should I work with? What kind of audiologist is the right fit? What kind of services can an audiologist even provide? And always coming back to you, Dr. Michelle, of how your experience makes you really qualified for that. So with that, please give us an introduction about who you are and some background info.
Perfect. Happy to be here. So I am formally, by super long last name, Dr. Michelle Neidleman Kennedy, but I just prefer to be called by my first name. So please feel free to just either call me Dr. Michelle or Michelle. Perfectly happy with that. Let's see, to start off, I am located in North Jersey, about 30 minutes outside of New York City. So I've been very fortunate to be able to be in an area that we have no shortage of excellent healthcare. There are so many wonderful facilities. And I think that's something that drew me into working for Treble Health, was that not everybody has that luxury of being able to be surrounded by so many great healthcare systems. And so this really, the avenue of telehealth helps bridge those gaps for people that live in more remote areas, or, even people that live abroad. So I lived in this area. I went to my undergraduate education was at the University of Connecticut. So I've also kind of stayed more or less in this tri-state bubble. And I went for my doctorate program here in New Jersey as well at Montclair State University. And I had a wonderful experience there. I've had a lot of wonderful placements. I feel like that eventually led me to the place where I am today. So I really enjoyed the hospital settings when I was a graduate student, which is why I ended up where I did. Basically, the bulk of my career has been at two of the major hospital systems here in New Jersey and New York. So the majority of my career has been spent at NYU Langone Health, New York University Langone Health Center or Medical Center. They keep changing up the name. And there I had a lot of great mentors. We worked alongside a lot of great otologists, otolaryngologists, worked with different professionals of different fields, neurologists, rheumatologists, physical therapists. So I feel like I had really a great career foundation because we were working that team dynamic. And I was able to work with both pediatrics and adults. I love the age range from newborns all the way to senior citizens, and working with hearing aids, auditory processing disorder, tinnitus, obviously hearing loss, balance. So I feel like I really got a great foundation of being, getting to do a little bit of everything that we do in audiology there. And then eventually I came to work at Hackensack University Medical Center here in New Jersey. I left NYU after having my first daughter, and it was more of a work-life balance. The commute, although I'm not that far out of the city, I'm taking public transportation. It's like a day and a half. I'm exaggerating, but it was like a 3-hour commute, from door to door, both ways. So after I had my first daughter, I had to kind of readjust, but I had the great opportunity to work at Hackensack, which is the #1 hospital here in New Jersey. It's a lot closer to home, about 30-minute drive. And there I was able to work with mostly pediatric patients with hearing loss or, speech delays that were coming in for hearing testing, and then working with primarily adults with balance and vestibular disorders. And what I really liked about my position there was that we had a large team of audiologists. So at NYU, where I was working, we were a smaller group at the time. So it was my first time being one of 10. And it's really fun to be able to work with such a large group of people. You learn so much from one another. And then this opportunity arose to work with Dr. Ben Thompson here at Treble Health. And it just came at a right point in my life where I was really looking for building better patient connections, with having more frequent visits with patients, because I wasn't getting that at my hospital position. It was mostly, doing single tests here and there. And I wasn't being able to develop those longstanding patient relationships that I was so desiring. And so that's what really attracted me to this position, because I've always been interested in tinnitus. And I feel like there was such a gap in what kind of support individuals with tinnitus receive, no matter where you are located in the world or in the US. And so it really seemed like this would be such a rewarding position. And it really has been. I've been here now for like 6 months, and it has been so incredibly fulfilling getting to meet patients from all walks of life, all places, all different places, all different points in their tinnitus journey. And it's just been a pleasure. So that's, a little bit about me and kind of what got me to this point. Any other questions I can
Yeah,
help answer?
absolutely. Thank you so much. That was wonderful. And you had shared with me previously that you've always had an interest in psychology, and tinnitus is a mental, psychological, auditory condition where we need to work on all those systems to manage it properly. So, at what point in your career did you realize, what were the feelings you were going through where you realized that being closer to the psychology, closer to the human experience of living with a hearing condition like tinnitus, and how did that exactly propel you to go into this field where you're working one-on-one with people? Talk to us more about that decision to work with people and be more involved in the human process, the human psychology, and the tinnitus management, how it led to that.
Sure. So I feel like it's a really roundabout process that got me to this point. But originally, when I went to college, I had thought I wanted to be a dentist. And then things kind of changed. And I feel like I fell into the right profession because now I get to have an actual talking relationship back and forth. Whereas if I had been the dentist, I would have just been talking at you and you wouldn't have really been able to talk back to me because I would have been doing things, in your mouth. So anyways, it's kind of funny that I ended up here because it really was I feel like a completely different type of patient relationship that I ended up with. I did major at my undergraduate degree is in psychology, and I have always had a huge interest in how the mind works and what we can do to change different outcomes, both physically and mentally, by just doing things, that involve the brain. And I think that having worked with individuals with both hearing loss, balance disorders, the families of these individuals, with tinnitus, you realize that there's such a huge component that relies upon how we feel and how we react to these things. And that really makes all the difference. And having more education makes all the difference in the success of someone who has tinnitus or in the success of someone who has hearing loss and is trying hearing aids for the first time. And so I think through different patient experiences that I've had, I've been able to realize how much my words or what I'm teaching or what I'm saying really does impact the overall outcome that an individual has based on whatever issues they have. Like I said, whether tinnitus, hearing loss, balance disorders, how it's affecting their everyday life. And from the last few years that I was working clinically, I wasn't really getting so much of that because we didn't have, like I said, I wasn't getting to see people regularly for follow-up visits. So the education component and being able to see the outcomes of how much better they may be doing after they've had, a visit with me was what ultimately led me to want to be able to do tinnitus retraining therapy and counseling and hearing loss, counseling and device counseling, because I really feel like you need to have those relationships with one another and be able to spend more time and dedicate it more to the whole thought process behind why we feel a certain way or why we are experiencing certain issues and what we can do to improve those.
And tell us about your moments of, wow, I love what I do working with patients via telehealth. I love to help people with tinnitus because it's helping them. Tell us about those stories of these positive, successful outcomes that you've seen at your time here with us at Treble Health.
Oftentimes really surprised by how just a small level of education or just some simple words that I didn't think would have so much power on a patient really does help them to see their situation or their tinnitus, their issues from a different light and different perspective. And so now it empowers them to be able to start to employ these changes that they need to make to improve their tinnitus, the way that they're reacting and feeling about it. Because a lot of times what I'm saying is not anything that is top secret, novel, unknown. It's oftentimes a lot of things that we already know inherently that we need to do, or things that are rational versus irrational when we're having, difficult days or difficult points in our life. I've been so surprised by how quickly some people turn around, where one day I'll meet with them and they really do see things from more shades of gray. And then when I speak to them in a few weeks, it's like light has re-entered their life. And there have been really small changes or just small transferences of energy in terms of how they viewed things from more of a negative standpoint to now a more positive standpoint. And now overall, their day to day is much better. And their attitude and the way that they feel towards their tinnitus or their hearing loss, for example, is just so much better than it was. And they may have made so much more progress in the past few weeks than they have had, in the months or even years that they've been dealing with this issue.
Excellent. Thank you, Dr. Michelle, for sharing a bit about your story and why you decided to specialize in tinnitus and hearing loss, and then sharing those moments of why you love what you do. I can certainly agree with you on that. It's gratifying when we receive feedback that the work that we're doing, that we've been trained to do, that we're the experts in, is making people's lives better, making their lives easier managing tinnitus. For those who would like to reach out to an audiologist on our team, including Dr. Michelle, please find us at treblehealth.com or follow the links below the video if you're watching here on YouTube, and we'll be able to help you, starting with a free consultation just to meet each other, and then from there, moving forward with the right kind of service or devices for you. Thank you again, Dr. Michelle, and we'll talk to you soon.